The National Institute for Communicable Diseases says that there's been a surge in fever-rash samples for testing, which indicates a surge of rubella cases in South Africa. Now, rubella is an infection that presents as a fever and a rash, an enlarged lymph nodes, a headache and conjunctivitis, some of the symptoms that go along with it. Now, as of week 40 on 2024, over 8,700 positive cases were identified in a test that measures the levels of antibodies in the patient's blood. Interestingly, 98% of these cases have affected children under the age of 15 to be exact, with the majority occurring in the 5 to 9 year age group. Now, Dr. Kerrigan McCarthy from the NICD says that this meant that there's been an unprecedented number of rubella cases in 2024, surpassing the figures from fever rash surveillance since 2015. So to chat to us more about this, we are joined by pathologist at the Center for Vaccines and Immunology at the National Institute for Communicable Diseases, Dr. Kerrigan McCarthy. Dr. McCarthy, pleasure to have you with us. Welcome to Morning Live.
Wonderful. Morning to you and your listeners.
So just how serious is this rubella outbreak, and what do these latest figures tell us about the situation in South Africa?
So rubella is a mild infection, as you've explained, and it presents in children, usually in South Africa between the months of September to December every year. And the reason for this is that South Africa, until this year, 2024, has not included rubella vaccine in our expanded program of vaccination. So every year, in springtime, we see a mild increase in the number of rubella cases that we pick up through our fever rash surveillance at the NICD. Now, rubella is transmitted through droplet transmission, through respiratory droplets, and it's not very infectious. And what happened during the SARS-CoV-2 pandemic was that the non-pharmaceutical measures that were implemented to control SARS-CoV-2, that's mask wearing and social distancing and the lockdowns, all prevented the transmission or the spread of rubella during the spring seasons. So our surveillance didn't pick up any cases of rubella, or very few, in 2020, 2021, and 2022. Now, seroprevalence studies, or studies that look at antibodies, show us that around 98% of women of childbearing age are immune to rubella in South Africa, and this is through natural infection. Every season, people who have not been exposed to rubella get rubella infection, and then they become immune. Now, because of the lockdown and the various mask wearing, rubella transmission never happened. And what that meant was the children who were very young at the time of SARS-CoV-2 and those who were born during 2020, 2021 and 2022 were never exposed to rubella infection. And so this year, when the seasonal rubella happened in springtime, as it normally does, there were many children who entered this year without antibodies to rubella, and so they became infected. And so we've had an unprecedented increase in the number of cases.
And of course, we don't have time, Dr. McCarthy, but what can people do, in order to try and protect themselves, their children, and just avoid a further escalation of this outbreak?
So fortunately, rubella is almost harmless in children. There are very few complications and certainly absolutely no deaths due to rubella infection. The only concern, and the reason why the World Health Organization is joining rubella with the fight to eradicate measles, is that rubella infection in a pregnant woman who's in her first trimester of pregnancy can lead to congenital rubella syndrome. And this may result in fetal loss, death, and congenital abnormalities such as congenital heart disease and blindness and deafness. And this is obviously a highly undesirable consequence of rubella. The fortunate thing is that congenital rubella syndrome is incredibly rare. As I said, 98% of women of childbearing age have been exposed to rubella or vaccinated. So in terms of what people can do going forward, the Department of Health has implemented the rubella vaccine in 2024. So it will be administered to children with the measles vaccine in a single injection at 6 months and 12 months. And various catch-up strategies are being proposed to the Department of Health by the National Advisory Group on Immunisation.
Dr. Kerrigan McCarthy, thanks so much for your time this morning talking about the latest rubella outbreak. And of course, other shows will carry more on this. We need to take a quick break.